Hi.
All right, everybody. So welcome this week. I think we are in our third or fourth week. We're in our fourth week
Mhm.
of our winter webinar series. And this week we have a guest speaker with us, Diane Cooper from Come Outreach. She is a geriatric nurse practitioner with 30 years of experience in the field. She's a very knowledgeable individual, and she is actually an experienced caregiver herself. And she's going to tell us more about that, I'm sure, tonight. And as a result of her firsthand experience, she started Come Outreach, which is a nonprofit organization whose mission is to focus on getting resources to caregivers because they all need care too. It's an extremely taxing but rewarding job, and caregivers were in short supply before, but COVID has really created a lot of extra issues and challenges that caregivers are facing.
Mhm.
So Diane is here tonight to share with us more about how we can care for the caregivers in our lives, and if you are a caregiver yourself, how you could make sure that you're taking care of yourself. So Diane, I'm going to turn it over to you.
Okay.
If you want to,
Thank
I don't know if you want to share your screen,
uh, how do I do that? Share my screen as far as
right?
with
Because I
the
think you have a presentation.
okay.
At the bottom, it says share screen.
Okay, so go directly to that.
Yeah,
Okay. Oh, I did it.
there you
Okay.
go.
So I'm gonna go to view, um, and go to slideshow.
There you go.
Okay. Okay. Oh my God.
She's doing
Hi, my name is Diane Cooper, and I'm the CEO of Caregivers Outreach Mentorship Empowerment. We are an organization that advocate for family caregivers. And when I say advocate, I mean that we try to get information to the caregiver to make it accessible, as far as resource information, in addition to helping them to go through this journey of caregiving. I started the organization because I was a caregiver for my dad, for my mom, and presently the caregiver for my husband, who for the last 10 years was actually on 24 hours of oxygen. He recently got a lung transplant about 2.5 years ago, so he's no longer on oxygen. Glad about that. Just kind of like building up his strength and his endurance at this time. So still a little weak, but totally independent in doing for himself. So being a caregiver, I like to tell people is that yes, I have the knowledge, the book knowledge, but I also have the experience of being a caregiver. And sometimes I think that as caregivers, people forget that we need caring also. Have you ever gotten that phone call where they say, "Hey, how's your husband?" or "How's your daughter?" or "How's your son?" and no one even asks, "How are you?" So I don't think they do it on purpose, but I think it's just that sometimes they forget that caregiver needs caring too. So tonight we're going to talk about feelings, thoughts, and realities. And the reason why I picked this subject is because basically we all have different feelings and thoughts as caregivers. And a lot of times we question those feelings and thoughts that we have because we think that we should not think that way or say certain things a certain way. But I'm going to call it feeling, thoughts, and realities. I'm going to call it the elephant in the room. Okay. And the elephant in the room is that I'm okay, you're okay, and we need to be reaching out for help. Some of the things for elephant in the room is that sometimes as caregivers, we may feel like we're confused not to the point where we don't know our name or the days of the week, but just confused on the journey that we should take as far as undertaking this role of being a caregiver, confused about the medical system, confused about how to maneuver the system as far as Medicaid and power of attorneys and things like that, and funeral arrangements. We get confused sometimes about that. However, we also can get confused by having so much on our mind that we tend to forget things and forget, exactly what we need to focus on. Loneliness is something that caregivers we experience because a lot of times, as being a caregiver, we get isolated because after a while, those friends that used to call you to go out and do things, they say to themselves, you know what, I'm not even going to call because they probably can't go. So what happened is that you tend to find yourself in an isolated, lonely situation because people stop calling, either that or we think that people just don't want to hear what we have to say. That, how are you? Well, you say to yourself, do you really want to know how I am? Do you really want to hear my story?
loaded
You know?
question.
So sometimes we tend to hold on to things and not really express what's going on in our life as a caregiver. Unexplainable crying, that happens where actually we can be talking about the situation that we're in and we just start to tear up, talking about the situation. And this is another way of saying that, what, we're overwhelmed with what's going on. And that's why we have that explaining crying sometimes. And grief, someone may say grief, are you talking about death? Are you talking about dying? No, I'm not talking about death and dying. I'm talking about grieving the loss of the way a person used to be, grieving the way your life used to be, grieving just that maybe you can't do the things that you used to do, grieving the point that you're seeing your loved one maybe with Alzheimer's or dementia just slipping away, and you're grieving that time. So what I like to tell people that as a caregiver, that a lot of times, especially if it's a loved one with Alzheimer's or dementia, and if they were to pass that end stage, people will look at you and say, wow, she's taking this really, really good. I mean, she's not showing any kind of, expression. She's not really grieving. And what they don't realize is that you've been grieving all along. Every day you're grieving. So a lot of times when a person gets to that point where they have passed and people from the outside are looking for us to grieve, they don't realize that we've been grieving all along. And it's more like a relief for us knowing that that person's not suffering anymore and knowing that that person's not going through, the stuff that they used to go through. So grief is something that caregivers get. Sadness, of course, we feel sad about what we're looking at. Frustration, because sometimes we feel like we're trying to help an individual and they don't take heed to what you're trying to help them to do. So you get a little frustrated. I'm trying to help you. I'm only doing this for you. I'm not doing it for me. And they say, no, I don't care. I'm not going to do it. So that can get a little frustrating. Overwhelmed, yes, overwhelmed, because what I always say is that the caregiver's journey is something that's very new. There's a newness of it. And basically, unless you've been a caregiver before, just taking on for the first time, it is something that's new. Um, there's just no book out there that can tell you how to be a caregiver for your situation, your uniqueness. They can tell you how to take certain steps as being a caregiver, but you can't tell me how to be a caregiver and then tell somebody next door how to be a caregiver because their family dynamics are different. So when you're explaining this to someone or trying to help someone, it's unique. It's not a cookie cutter, you know, remedy or cookie cutter solution. It's very unique in itself as being a caregiver. You may feel invisible sometimes. A lot of times, for instance, when I take my husband to his doctor's appointment, they're like, hi, Mr. Cooper, how are you? And nobody again acts like I'm there. You know what I'm saying? So a lot of times what I do, I tell my family members and friends, when they call my house, they don't ask how my husband's doing first. What they do is they say, how are you doing, Diane? And then they ask for my husband because I got them straight on that what about me? And I'll tell somebody who constantly asks about my husband, I'll say, and what about me? In a laughing matter, just to let them know that caregivers need caring too. Depressed, yes, sometimes caregivers do get depressed. And I like to say, you do have those times, those moments when you get depressed. And, we all have those little moments. But I think when it gets to a point where that depression lasts a couple of days, a month, a couple of months, then that's when you should help. Seek help and counseling or to speak to someone, in that matter. Helplessness. Helpless as far as you just don't know what to do. You're kind of like you feel like you're right in the middle. And if you go right or you go left, it doesn't change anything. It doesn't make a difference. So you're like, oh my God, what do I do? Forgetfulness, sometimes as a caregiver, we do forget things. For instance, I just forgot that I had an appointment the other day. And it wasn't that I had dementia or Alzheimer's or anything like that. It's just I had so much on my plate. And we tend to get, a little forgetful sometimes. Unable to pray, for those of us who use prayer as a tool to get us through our journey, sometimes, you just say, God, where are you? I'm going through all of this. And sometimes it's a little difficult for us to pray and ask for that help, from a higher power. Well, taking care of you. Talk about your caregiver's role. I think it's really important that you talk about your caregiver's role. And if you feel that your friends and family members don't want to hear what you're saying, then find yourself a support group or a group that don't mind listening to what you're going through. I think sometimes as we talk about our caregiver's roles, it gives us a chance to hear ourselves. And sometimes we can hear how unrealistic we are when we talk about our caregiver's role, because we'll say something and they're like, wait a minute, I can't do that. And then I also think that just talking about your caregiver role will help someone else. Like I often like to say, like, sometimes when you're in a room talking about your caregiver's role, that someone can maybe see or hear something that can help them. And that's what it's all about, with that caregiver's connection, trying to help someone else and connect with people. Take a respite and break often. A respite for some may be just taking a walk every day. It may be reading a book. It may be going to another part of the house or a room. It may be just going away for a day, going away for a weekend, going away for a week. I can't tell you what a respite can be for you. You know what you need and you know what you're capable of doing, but you definitely need to take breaks. I often tend to take good respites. I take a week vacation on places. And my husband just loves me dearly when I get back because I am just singing and just so joyful. And honey, what do you want? So he doesn't mind me taking my little breaks. And I think that'll help you also because what it does is kind of like make you step away from the situation. And then you come back refreshed, revised, and ready to deal with the situation again. And you want to ensure that all your legal documents are in order. What I like to say is that you never want to wait for a crisis to take care of a situation. So you know what you need to do to get those documents and those things in order. And you have a list here that can actually tell you what you need to do. So you don't want to wait until a crisis to get those documents in order. Be open to new technology. What do I mean by that? For instance, sometimes you have long distance caregivers. And basically, you may say, well, I live in New York and my mom lives in Florida. How can I be of help to my mom? Well, one way you can be of help to your mom, talking about using technology, or any family member that may not live in the same borough across the street or down the block from you, is that you can kind of like get into, they have some organizations call it My Chart. I think it's something My Chart. Most organizations have something where it's something about My Chart. And
Uh-huh.
what My Chart is, Martha Fuhr has it, and I love it because I use it for my husband all the time, is that you actually can go in and see the doctor's note. You can go in and see the blood work. You can go in and see the upcoming appointments. And that's how we keep up with all his appointments and things like that. So don't be afraid of technology when it comes to, caring for your loved one. Take advantage of that because that really does help a lot when it comes to organizing and keeping a balance, with your life and what's going on.
Can you
And
share what you just told me? I'm sorry to cut you off, but share what you just told me about the Zoom respite for the
ah,
people with Alzheimer's, because it kind of hits 2 points here on the screen: is new
uh-huh.
technology and having a respite for yourself.
That is so true. I forgot about that. Thank you. That's true. And I think because of the COVID, a lot of us are going Zoom, kind of like with respect, are doing that. So that's a great idea. Um, and I'm trying to think what else for technology. Basically, they have all kinds of technology where you can actually help your loved one when it comes to taking medications. It'll say talking medicine dispenser. You can also ask your pharmacy. Some pharmacies are actually pre-pouring the medicines for your loved ones and things like that. But there's different apps that you can get if you're a person who use apps and stuff to help when it comes to managing your loved one's medication. You know, so think about that when it comes to technology, and then allow yourself to have that moment. So what I do is that there's some days where it's just so overwhelming and I go into a quiet place and I do whatever I feel like doing. If I feel like crying, I cry. If I feel like screaming, and sometimes I do it, my husband's like, what are you screaming for? But whatever you feel like doing, whatever you feel like doing, have that moment. It's okay to have that moment. And just know that, you just don't live in that moment, but have that moment. It's okay. It's normal. We all go through, those days where it can be overwhelming, and it's normal. It's okay to have that moment. And taking care of your own health, that is very important. um We have to take care of ourselves. And I know you all have heard this 1,000 times. You know, when you're on the airplane, they say to put your oxygen on yourself first before you put it on someone else, because, you know, you have to be able to take care of you in order to take someone else. And I'm sure you all have heard it a million times, the importance of taking care of you. But it is so true. You know, I talk to caregivers often who's in a situation where it's really, really difficult, and they're like, you know, I'm going to do this, I'm going to do whatever it takes, whatever. And I'm like, yeah. And if you were to have a heart attack, have a stroke, or drop dead, what's going to happen to the person you're caring for? Oh, I never thought about that. So basically, you know, in order to care for someone else, you have to take care of yourself so you can continue to care for the person you're caring for and be an advocate for that person that you're caring for. Know the signs and symptoms of caregivers burnout. Um, I kind of like mentioned some of those things, or most of those things: crying, depression, sadness, loss of appetite. My mom had caregivers burnout when she was caring for my dad, and us as females, she was actually a size 18 and she went down to a size 7. She thought she had cancer. She thought she had all kinds of diseases because she couldn't imagine going from an 18 to a size 7. But as we were trying to tell her that it was just that it was caregiver stress, that she was just burning herself out, you know, and it came to a point where we actually felt we was going to lose my mom in addition to losing my father, who also was stricken with Alzheimer's and
Wow.
also was paralyzed. So she realized that that was stress, and, you know, she did take care of that situation. Inform your doctor and employer that you are a caregiver. When I talk to my caregivers, a lot of people are not aware that there's so many services now for caregivers when it comes to being employed. You know, you got the paid family medical leave, you have the family medical leave, you have all the different services and activities that your job may offer for caregivers. And I always say, let your job know that you are a caregiver, because a lot of times, I know sometimes we get afraid of doing that because we say, you know, if I take off too much or if I call out sick too much, they're going to say, you know what, I think that, you know, maybe you're caring for your loved one is kind of like having an effect on your job. So I totally understand that sometimes you're a little hesitant in telling your job that you are a caregiver. But I also think that we have to continue to speak up that we are caregivers and take on that role of being a family caregiver and let people know our needs that we, in order to be the caregiver to care for that loved one the way that we, you know, that we should and we want to. Let your doctor know that you're a caregiver. I often tell caregivers that a lot of times you go to your doctor, you know, your blood pressure's high, you're all stressed out, everything's out of whack, and never once did you tell your doctor you was a caregiver. So what he did, he give you that little pill. And you don't need a pill. You probably just need to express to your doctor that you are a caregiver, and maybe he can suggest a support group or, you know, some services to you. And I like to tell caregivers, whoever you can express what you're going to, maybe a doctor, whoever you want to do that. But definitely let your doctor know that you are a caregiver, because when you see that it's starting to affect, you know, your vital signs, it's starting to affect, you know, it's anxiety levels and all, then that's also an indication for you that you have caregivers burnout and you need to do something about it. Don't be afraid to ask for help. A lot of times we ask our family members and friends to help us, and what we do is that we say, no one, you know, no one volunteers to help us. You know, my sister, she sees me caring for my mom and dad, and she never volunteered to help. And I like to say that the reason why people don't help us is because basically it looks like we got it together. You know, you look like you got it so together that people get afraid to say, I'll do this, because they're afraid you may say, oh, I'm not doing it right. Or, so people are afraid to approach you to help sometimes because you look like you have it together. And to suggest that they want to help you, it may be an indication that you feel that they don't have it together, that you don't have it together. So I like to tell people that when you ask people for help, be very specific about what you want. When you say, I want help with mom, say, would you go to the doctor? Would you cook a couple of meals for us? Would you take her for a weekend? Say exactly what you think the help is, because someone else's help may not be the help that you think you
That's a
need.
good point.
Yeah, you know what I'm saying? So tell
That's
her
a
what you
very
need.
good point.
And last but not least, of course, you want to join a support group or you want to join a group, especially with all the Zoom that's going on now, a group that you can express your feeling and not be judgmental about it. You can express it. I like to say that when a caregiver say, "Oh, my husband, he got on my nerve. I just wanted to kill him." You don't really mean you want to kill him. Nobody's going to call the cops on you or anything like that. So as a caregiver, we know that. We know when you say things. We know that when you say things like, "Oh, my mom, or my dad, they really just got on my nerve today." We know that it's not that you don't love your parent. It's not that you don't love your husband. This is just what we say and do as caregivers. And you're able in a support group in that environment to say these things and not be judged and also be understood. One thing I love with all that who I am and all that I've achieved in life, I love the connection, the love that we have as caregivers. And I love it because basically it doesn't matter, where you're from, how much money you have, but there's always that connection between caregivers, and that is the oneness and the knowing and the understanding. And that's what I love doing what I do with caregivers because I always feel connected, with caregivers than anything else, not even my peers, who may be, other doctors or nurses. I have more of a connection with being a caregiver and speaking to caregivers because there is a connection as you are a caregiver. So I hope I didn't rattle too much, but I say caregivers, give yourself credit for doing the toughest job ever. And I think we're just ordinary people doing extraordinary things. And if you want to just give us a ring or call us, whatever, you can please visit our website at comeoutreach.org. And our telephone number, as you see on the screen, is 718-379-3159. And we offer all kinds of different services. And let me just throw this in that if you are aware of any children or youth that are family caregivers, we also have a program where we actually do just what we're doing now, Zooms and support groups for children who are family caregivers, because we don't realize that there's lots of kids out there that are actually assisting a sick elderly loved one or a sibling who may have a disability or an illness. So if you know of any children or youth that are caregivers, please feel free to refer them to us, and hopefully we can help them too. And
Would you mind just telling us some more of the services that you do offer caregivers when they come to you for help?
Okay. So basically, we do the caregivers consultation, where we actually meet with family members, the primary caregiver, and anyone who's involved with caring for that loved one, and we actually leave you with a roadmap. This is the only services that we charge for. Everything else we do is free of service, but we do do a fee for that because we are a nonprofit and we do need to have income coming in. But everything else, as far as the workshops, we do support groups. Because it is Zoom, we're just going down to once a month right now until we get back into the speed of things again. But mostly what we do is a lot of outreach before this COVID came out. I mean, you could have found us in a church, in an organization, working along with different organizations to bring the resources, panel discussions, to the caregiver. We also have a program that we do in the summertime. It's called the Intergenerational Program. And what it is that we take youth and we have them to come into our office, and we have the adults or caregivers or anyone who needs assistance with their devices. And the kids will actually help them to learn about their devices. And it's so unique and good because most of the time, your adult will have a device that they have gotten around Christmas time and they didn't even open up the box. So when they come to the kids, they're like, "Oh, my daughter or son gave me this, but I never opened the boxes. I was afraid." And just to see the kids and the seniors working together, it's really, really nice, with them doing that. And then again, the youth caregivers program that we have. And I'm trying to think, and case management. We have a program also where if somebody lives a distance away from their loved one, we have case management where we will have one of our social workers go in to the person's home. Let's say somebody lives in Florida, a loved one lives in Florida, and someone lives here in the Bronx. You can actually call upon us, and that social worker, if you wanted them to go in to check on that home health aide every month or check and see how your family members doing, we can do that. If a person goes into the hospital and you want us to go in to see what is the discharge planning in the hospital, making sure they get all the services they need, we can do that. And of course, that is a fee for the case management part. But we also do that, and that's called case management. I'm trying to think what else, what else, what else, what else, what else. I cannot even think right now.
No, I mean, that's great.
But
That
I'm
you're
gonna ask you guys, I'm gonna ask them to go to the website and check out some of the services that we do.
Yeah,
Yeah.
no, I mean, it's a great organization. I mean, your presentation, Diane, was super insightful, and I think it helped put a name to maybe some of the ways that the feelings that people were thinking. But sometimes it's hard to put those things into words, or you feel bad about the way that you're
Yeah.
feeling. But a lot of this just kind of comes with the territory, and I
Yes, it
think it's
does.
important to feel, acknowledged.
Yes.
You acknowledge those things, and then you navigate your way through them.
Yes. Yes.
So thank you for taking the time to come and speak with us tonight. If anyone has any questions, feel free to reach out to Diane. She's like a huge wealth of knowledge. And I hope everyone comes back next week. We'll talk about retirement planning next week on our webinar series. And I will send you this recording, Diane. So
Okay. Sounds good.
share it.
Sounds good. So I can critique myself.
Exactly. And you did great with the PowerPoint. So,
Thank
all right,
you.
everyone. Well, thank you for joining us this week, and we'll see you next week.
Okay. Thank you so much for having me.
No problem.
Good
Have
night,
a good
everyone.
night.
Okay.
Bye.
Bye-bye.